This is Coach Tess from HealthEversity, and today we are going to be focusing on cardiovascular keywords for the CPC board examination. So let's jump right into it. So at the beginning of my videos, I always say to you, take your time. And the more you hear it, is the more you're going to start to practice it. When you're starting as a student, it's easy for you to just rush and try to do practice questions and all of those things rather than trying to get the skill, to learn how to do these scenarios. Get to know a lot more, enhance, sharpen your skill on medical terminology and A&P. That's very, very important. Also learn how to do the process of elimination. That will help you with your speed and accuracy. This exercise that I'm going through will help you with your accuracy so you can move faster. It might seem crazy and everything, but believe me, it works. So if you can read a scenario and you can identify your procedures, identify your diagnoses, as well as your anatomical sites, and other words in each section, you will have a better advantage. Please don't jump and try to just answer questions just because you're excited to answer the questions and rush to finish. Master these skills, so when it's time for you to really, really jump into it, you will be fine. But take your time. Please be patient with yourself. Please don't be hard on yourself. If you have any questions, please send me a message. Ask a question. We will surely be happy to help you. Okay? So let's jump right into it. So we are focusing on cardiovascular today. So cardiovascular can be very challenging with some of the words in cardiovascular. So this is where we are going to focus on. A lot of it is procedure wise. Okay? A lot of them is procedure wise. So it's quite a bit, but we'll get through it. Okay? So let's get through it right here. Let's go through it. Okay, so the first word is anastomosis. Anastomosis is joining of two or more blood cells. It's like you have two straws and they basically put them together either at the two ends or beside each other. So that's anastomosis. So you'll find that a lot in digestive too when they're working on the digestive tract as well as in cardiovascular. All right, so here is a procedure. Angiography. See? Graphy. They're working on vessels. Angio. So graphy is a procedure. Plasty. Angioplasty. Annuloplasty. So if you notice that at the end of each word right here, so you have the graphy, you have the plasty, you have the plasty again. Be careful. These are all surgical repairs, or they call it surgical reconstruction. And then you have antegrade. A lot of it is moving forward, but then sometimes it goes backwards where you see the term retrograde. So you have antegrade and you have retrograde. All right. So now if they're measuring the heart, irregularity is arrhythmia. Measuring, but that's what it's called, right? Irregular heart rate. All right, let's move up again. Arthrosclerosis. Sclerosis is a hardening. So, sometimes you have muscular sclerosis. Okay. Now we have arthroectomy, arthrosclerosis. So you have arthro. Look at this. Pay attention. You have arthro and you have athro. So one is building up plaque in the artery walls, and one of it is the hardening of arteries. So those two, you might see both of them in a scenario and they look so close. and you are rushing to finish the question and you're not paying attention and you get it wrong. No. So pay attention. All right. So you have atrioventricular, you have purification. So like sometimes, let's use, you might say purification in some of the veins in your neck. So you will see some of that. Bundle of His, that is the electrical conduction in the heart. Capillaries, so if you look on some of those diagrams, you might see circulator diagrams, you might see, let's say, for example, the arteries are red and the vein is blue, and in between it you see this mesh type of thing. That is the, what you call it, transition between an artery and a vein. That's where your capillaries are, that little purple color. So most times if you look on those diagrams, you will see that. All right, so you have cardioversion, I can never pronounce this word for real. Okay, so is Chande ten. Somebody send me a message and tell me how you pronounce this word. Chardante. Honestly, some of these words are hard to pronounce, and I'm not perfect, and you're never able, and don't be hard on yourself. I find it fun when I can't pronounce a term. I go ahead and research it and make fun of myself. So don't feel bad. Okay. All right. Coronary. So you have different systems in the heart. You have the circulatory system, you have the coronary circulation, all of these things you can see. So you have endocarditis, epicardial, implantable defibrillator. Now you might have the pacemaker and the defibrillator. You need to know the difference between the both of them. So the implantable sorry, let me get my thoughts back together. So the implantable defibrillator is a device delivering electric shock. Well, the pacemaker measures it. So you have to pay attention to look it up, the difference between an implantable defibrillator versus a pacemaker. Okay, you have infraction and you have intracoronary within the heart, a myocardial, right? So you have like acute myocardial infraction. So look at this, you have infraction and you have myocardial, AMI. So you kind of have to look up that. That's a diagnosis, right? I put AMP there, but it was wrong, right? Okay. And I put the AMP right here. That was wrong. You know, I was a student, so you know. This is my student book, and that's why I kind of use it to show you imperfections as a student and how you make those mistakes, right? Okay. All right. So let's look at non-selective catheterization, right? So you have non-selective, right? And you have non-selective and you have selective catheterization. You have non-tunneled and tunneled catheter. So you have to look at the difference between both of them when you're reading the scenarios. This exercise is very, very important, guys. Don't take it for granted. Okay, you have prolapse, is sinking of an artery, of an organ or a part. Pulmonary circulation. So look at this, see? You have coronary circulation, and now see, you have pulmonary circulation right here. So you have the different systems within the heart. So the pulmonary is the one that leads the oxygen, that leads the blood that leads from the heart into the lungs, back and forth. So you have the circulation that there's another circulation that leads from the top, the blood that leads from the top of the heart to down the bottom. And then you have the circulation that comes from out of the heart into the heart. So basically, look at the different circulation systems. Okay, so you know Purkinje fibers, that so you have the Purkinje fibers, the bundle of His, those help with the electrical conduction of the heart, that creates electricity in the heart. All right, retrograde, you remember we talk about antigrade. So we have, let me go back over here and see if I can find it. Okay, there you go, antigrade. And let's go over here and let's find retrograde. So one is moving forward and one is moving backwards. Got that? So pay attention to some of these words. Just the end word might be the same, but the beginning might be different. So the suffix might be the same, but the prefix might be different. So you have anti and anti, and you have retro. Okay, revascularization is supplying blood. So for example, you have what do you call it? You have what do you call it? I can't remember. My brain cannot work crazy. So what they do with the revascularization, sometimes they have low blood in certain veins, and they basically establish those blood flow in those areas. Selective catheterization. Now look up the top. You said non-selective catheterization. Now you have selective, right? So look up the top. You have tunneled catheter, and then you might find down here tunneled. So you might have to pay attention to some of these keywords. All right, stenosis is narrowing in the artery or the vein. It can happen anywhere else, but you'll see a lot of it in this section. Subcategory, see, look, you have synthetic circulation, so you have to pay attention. Thrombosis. Here you have embolus, thrombosis, thrombolytis. All of these things are building up areas, destruction of a blood clot. So you have all of those things when it comes to blood clot on the exam. Pay attention, okay? All right, let's go down here and see if I see anything. Tunneled catheter. See? Tunneled catheter, and you have non-tunneled catheter. All right, let's move over here. Valvular prolapse, valvoplasty, ventricle. Okay, so these are some of those words that you're going to find in your scenario, and these terms come from AAPC. So I am not telling you anything that I made up. This is from AAPC. Use your study guide. Go back through. See a lot of the mistakes I made on mine, and I left this imperfection to show you that when I started, I was making mistakes. So pay attention to some of the terms. Go in the back of your study guide and go through each one and say, well, okay, when I read the definition, go into your glossary. Pay attention to those terms. Take your time. Learn those terms as you go through each section, so that when you start reading the scenarios, a lot of these words that you see in each section, you will start to identify. Your study guide don't give you a whole lot. I don't know a lot. Sometimes they might change it up, but your glossary is at the back of the book. And so now I'm taking what's in the back of the book and putting it into sections, okay? So if you have any question, please subscribe to our channel, that we see how we can help you. Make a comment, see how we can help you. Send us a question on our website. My name is Coach Tess, and let me know if you have any questions. We're here to help you. Remember, we focus on tutoring and helping students. Anyway, have a good one. Talk to you later.